Now herein the cleft can be complete or it can be partial. When it is complete, it is called as bifid tongue as well, right? And partial exhibits a deep groove in the center. Now next is fissured tongue. Fissured tongue, remember the other name, it is called as scrotal tongue. Okay. Now scrotal tongue or fissured tongue is most commonly seen in Mercanson-Rosenthal syndrome as well as Down syndrome. Please remember this. In one of the MCQs they have asked where in which syndromes you find the scrotal tongue. So Mercanson-Rosenthal syndrome, you can find scrotal tongue. Now coming to the next entity, which is median rhomboid glossitis. Now there are two school of thoughts about it. Previously it was thought that the tuberculum impar remains at the same place and the fusion doesn't occur. So you have a diamond shaped area in the center which is devoid of any papillae. Nowadays the newer concept is candidiasis. Because of candidal infection, it leads to the formation of depapillated area. So it is most commonly seen anterior to the foramina secum, as you can see in the picture, and circumvallate papillae in the midline of the dorsum of tongue. Clear? So if they are asking about recent literature, obviously your answer will go as candidal infection is the thing which is causing the median rhomboid glossitis. Yeah. Coming to the next entity, which is benign migratory glossitis. Now this question has been so many times gummified with other names, right? So remember, it is also called as geographic tongue, it is also called as wandering rash of tongue, it is also called as erythema circinata when it appears on other parts of oral cavity other than the tongue. If it appears on the buccal mucosa or floor of the mouth, it is called as erythema circinata, right? Or else the other names of benign migratory glossitis are geographic tongue, wandering rash of tongue. Now classical thing to remember over here is differential diagnosis of Monro's abscess. You have Monro's abscess, which are intraepithelial accumulation which is most commonly seen with benign migratory glossitis as well as seen in psoriasis. Remember the differential diagnosis, you have both in psoriasis as well as over here. Remember that there is lack of filiform papillae in benign migratory glossitis. Please keep that in mind. Benign migratory glossitis, erythema migrans, wandering rash of tongue, depapillated areas. The depapillation can be seen at different sites after few days or some if the time passes on. Then hairy tongue, you have marked accumulation of keratin on the filiform papillae of the dorsum of the tongue. Now it is classical hairy appearance because you have a hypertrophy of the papillae which makes the tongue difficult to get clean. Okay, along with that, nowadays they have suggested that it can be because of candida as well. So it has both the etiologic factors which are to be considered, and classically it gives black, brown or yellow hairs. If some question comes as where you find black, brown or yellow hairs on the tongue, now hairy tongue is also seen associated with which infection? Most common viral infection nowadays is HIV. Okay, in HIV also you can see hairy tongue. Although not as prominent as that of candidiasis and all, but yes, in HIV you can have hairy tongue. Hypertrophy of filiform papillae. Please note this down. In benign migratory glossitis, you have lack of filiform papillae. In hairy tongue, you have hypertrophy of filiform papillae. Now coming to the next entity, which is lingual thyroid nodule. Now in one of the MCQs, they have just simply asked that whether you will excise lingual thyroid nodule, yes or no. Okay, there were options that yes, no, surgery needed, not needed. So what will be your answer? No. Why not? Yes, because the some part might be entrapped, which might be functioning properly, which might be responsible for the normal thyroid function, and therefore you are not supposed to take it down unless and until you do all the levels and everything, and you have to manage the patient accordingly if you are removing the luteal thyroid nodule. So, if they ask if surgery is planned for luteal thyroid nodule, the answer should be no. Whether you should surgically excise luteal thyroid nodule, answer should be no.